HESI Exit Medical Surgical Nursing, Mastering the Respiratory System. Introduction. Welcome to our comprehensive review of the respiratory system for the HESI Exit exam. Today we'll cover understanding respiratory anatomy and physiology, recognizing common respiratory disorders and interventions, applying critical thinking in respiratory emergencies. This system is crucial because respiratory illnesses are common in both acute and chronic care settings. Nurses play a key role in oxygenation, ventilation, and patient education. Respiratory anatomy and physiology. Let's explore the respiratory system structure. Upper respiratory tract. Nose, pharynx, and larynx. Lower respiratory tract. Trachea, bronchi, lungs, and alveoli. Key functions. Gas exchange, oxygen in, carbon dioxide out. Maintaining proper ventilation versus perfusion balance. Pulmonary function concepts. Understanding these concepts is essential. Types of respiration. External respiration occurs in the lungs. Internal respiration occurs at the tissue level. Ventilation versus perfusion. Proper V/Q ratio is required for adequate oxygenation. Oxygen transport. Hemoglobin plays a crucial role. Understanding the oxyhemoglobin dissociation curve is important. Respiratory diagnostic tests. Key tests for respiratory assessment. Arterial blood gas, ABG, measures pH, oxygen, carbon dioxide, and bicarbonate levels. Pulmonary function tests evaluate lung capacity and airflow. Chest X-ray identifies infections, fluid collections, and collapsed lungs. Sputum cultures diagnose infections like tuberculosis and pneumonia. Pulse oximetry measures oxygen saturation levels. Pneumonia overview. Pneumonia involves inflammation and fluid accumulation in the air sacs. Types of pneumonia. Community-acquired pneumonia, CAP. Hospital-acquired pneumonia, HAP. Signs and symptoms. Cough, fever, difficulty breathing, lung crackles, and infected sputum. Nursing interventions. Oxygen therapy and antibiotic administration. Proper hydration and breathing exercises. Incentive spirometry and pulmonary hygiene techniques. Chronic obstructive pulmonary disease, COPD. COPD is a progressive airway obstruction combining emphysema and chronic bronchitis. Risk factors. Smoking, air pollution, and genetic factors. Symptoms include difficulty breathing, chronic cough, and sputum production. Barrel chest appearance, finger clubbing, and wheezing sounds. Management strategies. Medications, bronchodilators like albuterol and ipratropium, plus corticosteroids. Oxygen therapy, maintain oxygen saturation between 88 to 92%. Lifestyle changes, smoking cessation and pulmonary rehabilitation programs. Asthma, reversible airway disease. Asthma is characterized by reversible airway obstruction. Common triggers. Allergens, cold air, exercise, and stress. Disease process. Inflammation, muscle spasms, and excessive mucus production. Signs and symptoms. Wheezing sounds, chest tightness, difficulty breathing, and coughing. Management includes rescue medications, short-acting beta agonists like albuterol. Controller medications, inhaled corticosteroids and leukotriene inhibitors. Patient education, trigger avoidance and proper inhaler technique. Tuberculosis, airborne infection. Tuberculosis is caused by Mycobacterium tuberculosis bacteria. Symptoms to watch for: night sweats, fever, coughing up blood, and weight loss. Diagnostic methods. PPD test, positive if 10 mm or greater in healthy individuals. Chest X-ray and sputum culture confirm active disease. Treatment protocol. RIPE therapy, rifampin, isoniazid, pyrazinamide, and ethambutol. Infection control, airborne precautions with N95 masks and negative pressure rooms. Life-threatening respiratory conditions. Pulmonary embolism. Blood clot travels from legs to lungs, obstructing blood flow. Symptoms are sudden shortness of breath, chest pain, rapid heart rate, and low oxygen levels. Diagnosis uses D-dimer blood test and CT pulmonary angiogram. Treatment involves oxygen therapy and blood thinners. Acute respiratory distress syndrome, ARDS. Fluid leaks into air sacs, causing poor gas exchange. Causes include sepsis, trauma, and pneumonia. Requires mechanical ventilation with positive pressure and prone positioning. Pneumothorax and chest injuries. Pneumothorax. Air in the chest cavity causes lung collapse. Hemothorax. Blood accumulation in the chest cavity. Symptoms for both. Sudden difficulty breathing, decreased breath sounds, and airway deviation. Treatment. Chest tube placement for drainage. Oxygen therapy and monitoring for tension pneumothorax. Respiratory failure and mechanical ventilation. Types of respiratory failure. Type 1, low oxygen levels, less than 60 millimeters of mercury. Type 2, high carbon dioxide levels, greater than 50 millimeters of mercury. Indications for mechanical ventilation. Severe oxygen deficiency, respiratory distress, and altered consciousness. Nursing care priorities. Managing ventilator settings, airway suctioning, and sedation monitoring. Respiratory emergency priorities. In respiratory emergencies, follow these priorities. Rapid assessment. Check airway, breathing, and circulation. Key interventions. Provide oxygen therapy and proper positioning. Perform airway suctioning when needed. Administer prescribed medications like bronchodilators and steroids. Preventing complications. Monitor for respiratory distress and aspiration risks. Respiratory medications. Important drug categories. Bronchodilators, albuterol and salmeterol for airway opening. Corticosteroids, prednisone and fluticasone for inflammation. Mucolytics, acetylcysteine to thin secretions. Antibiotics, azithromycin and ceftriaxone for infections. Anticoagulants, heparin and warfarin for pulmonary embolism. Promoting lung health. Lifestyle modifications for optimal respiratory health. Smoking cessation significantly reduces COPD and lung cancer risk. Exercise and pulmonary rehabilitation improves endurance and reduces breathing difficulty. Dietary adjustments, high protein, low carbohydrate diet benefits COPD patients. Infection prevention, stay current with flu and pneumonia vaccinations, practice good hand hygiene. You've now mastered the essential respiratory system concepts for the HESI exit exam. Remember that early recognition of respiratory distress is critical for patient outcomes. As nurses, we play a vital role in maintaining proper oxygenation and ventilation for our patients. Continue practicing these concepts, and you'll be well prepared for success on your HESI exit exam. Keep up the great work in your nursing studies.